Not all Achilles tendinopathy is created equal. Today, we're diving into 4 unique subgroups of mid-portion Achilles tendinopathy and why addressing the differences in those subgroups can make all the difference in your recovery. For a long time, Achilles tendinopathy has been addressed with a little bit of a one-size-fits-all approach. In this particular study by Hanlon, Pollig, and Silbernagel has addressed 4 different subgroups and how identifying those subgroups can make a big difference in tailoring their treatment and predicting their outcomes over time. First up is the activity dominant group. This group is primarily healthy, active individuals, mostly runners, whom have tended to do too much, too fast, too soon. And they've overloaded their tendon tissues. Their tendon tissues, however, are still healthy and structurally sound. They're just angry. So our primary treatment strategy with these folks is to help them load monitor their training via training journals, pain monitoring parameters, and things like this. Our next subgroup is the functional dominant group. This group tends to be a little bit older than that activity dominant group. These folks are mostly in their 50s, also runners, but their tissues have changed a little bit. So we see a little bit more structural change in their tendon, and they've also lost a little bit of function or strength in their leg, such as calf strength, motor control, or just global leg strength and endurance, even though they may not have really big symptoms like the activity dominant group. So the strategies for this group tend to be more functionally oriented, like improving calf strength and improving global limb strength, while gradually bringing them back to their activity. Our third subgroup is the psychosocial dominant group. These athletes are middle-aged, primarily females. Their quality of life tends to be much lower than those athletes in the other groups. And their pain scores tend to be also quite a bit higher. Here, treatment strategies center around decreasing fear of movement, working to improve their overall health score from a global scale, and providing a lot of reassurances that what we're doing for them is okay and graduating them into movement again based on their goals. The other things we need to address with these individuals, if indicated and after some conversations, are community resources. If they need other helps outside of physical therapy, we want to provide that to those people. Our fourth and final subgroup is the structural dominant group. This crew tends to be male, not in great health, and they can demonstrate structural changes in their tendon tissues. For these folks, the prognosis tends to be much longer than the prior groups, and treatment strategies focus on helping to change the tendon tissue as much as we can with exercise or other adjunct therapies. Being able to recognize these subgroups can be crucial for both PTs and patients to develop appropriate treatment strategies and timeline expectations based on that patient's needs, whether that be symptom modification, training modification, load management, psychosocial helps, or structural changes to the tendons. Not everybody needs the same care, and we should approach that person with the care that they deserve based on how they present to us. So, if you've got Achilles tendinopathy, particularly of that mid-portion variety, just a couple centimeters above the heel, and you feel like you're getting cookie-cutter treatment wherever you might be, think of us. We're looking at you as the individual you are. We're thinking about your goals and the treatment strategies that are relevant to you and only you to move you forward in the most efficient, most effective timeline possible. Not every Achilles rehab journey is the same, but with the right lens, we can move you forward much more effectively. We identify who you are as a person and as an athlete. We use that information to tailor your treatment strategies to you specifically so that we can move you forward efficiently and effectively to get you back to doing what you love to do.